Which surgery is best for spine? Actually, the spine surgery can be categorized as major surgery and minor surgery. In major surgery, the surgeries such as scoliosis, deformity correction, fixation of major fracture comes. These surgeries are done by open approach and it requires a big cut on the back of the spine or on the side of the neck. But the best surgery for the spine is minimally invasive spine surgery. In minimally invasive spine surgery, the surgery is done by taking small cuts wherever the implant is fixed. For example, if there are four levers to be fixed, there are four small cuts. Through those small cuts, the guided implant is placed in the spine. Minimally invasive spine surgery requires smaller amount of time, it leads to less blood loss, the recovery of the patient is fast, chances of infection are less. So the best surgery for the spine is minimally invasive spine surgery. Thank you.